When you are a parent, noticing changes in your little one can be a source of worry, and understanding what those changes mean is so important. You might observe a subtle shift in their appearance and wonder if it signals something serious like dehydration. Yes, sunken eyes can indeed be a significant indicator of dehydration in infants. This particular sign is one of the more recognized and concerning symptoms that parents and caregivers should be aware of, pointing towards a need for prompt attention and sometimes medical evaluation. The skin and tissues around a baby's eyes are very delicate and close to the bone. When an infant becomes dehydrated, their body loses fluids, which can lead to a decrease in the volume of fluid within the body's cells and tissues. This loss of fluid volume specifically affects the fatty tissue and skin around the eyes, making them appear hollow or sunken. Infants are especially susceptible to dehydration because their small bodies have a higher percentage of water and a faster metabolic rate, meaning they lose fluids more quickly than older children or adults. They also cannot communicate their thirst effectively, relying entirely on their caregivers to recognize signs. If you notice your infant's eyes appear sunken, it is essential to look for other accompanying symptoms. These might include fewer wet diapers, which means your baby is not urinating as frequently, or a dry mouth and sticky tongue. Other signs can be a lack of tears when crying, irritability, or unusual drowsiness and lethargy. If you observe sunken eyes along with any of these other indicators, it is crucial to offer your baby small, frequent amounts of breast milk or formula. For older infants, an oral rehydration solution might be recommended by your pediatrician. It is helpful to know that while sunken eyes are a concerning sign, dehydration in infants often progresses through stages. Early signs might just be increased thirst or slightly fewer wet diapers. Moderate dehydration often brings dry mucous membranes and reduced elasticity of the skin. Sunken eyes typically appear with moderate to severe dehydration, highlighting the urgency of seeking medical advice. Always contact your pediatrician if you are worried about your baby's hydration status, especially if they are under 3 months old or have persistent vomiting and diarrhea. Recognizing sunken eyes as a potential sign of dehydration empowers you to act quickly and effectively for your infant's well-being. By understanding this important symptom and knowing what other signs to look for, you can ensure your little one receives the necessary care promptly, helping them stay healthy and hydrated. This proactive approach supports your child's comfort and recovery, turning worry into confident action.